Opioid and heroin addiction have exploded into a statewide crisis here in Connecticut, and the lives of those addicted and their families are being destroyed by this epidemic. We at the U.S. Attorney's Office are dedicating significant resources to helping the medical and law enforcement communities stamp out this deadly scourge.
Hi, my name's Deirdre Daly, and I'm the U.S. Attorney here in Connecticut. As many of you know, in Connecticut and throughout the country, we're struggling with an opioid epidemic. The Connecticut Medical Examiner anticipates 900 people will die from an overdose this year alone. That is about 3 times more than the number of people who will die in car accidents, and about 6 times more than people who will die from gun violence. In Connecticut, far too often we're seeing that the victims are young people, people between the ages of 18 and 26. And most often they start with an opioid prescription. 4 out of 5 new heroin users started with an opioid prescription. That is a startling fact. That means they got prescribed it for dental pain, a sports injury, or maybe they experimented with something they found in their parents', their neighbors', their friends' medicine cabinet, and then they got hooked.
If you go throughout the country, this problem is pretty much the same. And that's the thing that's really frightening. I think what we see here in Connecticut is an extensive issue with the number of individuals who are overdosing, dying. We're averaging anywhere between 40 and 44 a month in Connecticut.
I would characterize it as a major issue. We started seeing this a few years back, up in New Hampshire, started trickling down to our area, and it culminated this summer with us in one day responding to 20 overdoses. You've got, stay-at-home housewives. You've got teachers, doctors, surgeons, all having issues with addiction to these opioids. We're educating the officers. Our entire fire department is armed now with Narcan to be able to respond within 2 to 3 minutes. And we've even looked at possibly arming all of our officers with Narcan because it's become such a serious issue. So it is definitely a crisis that we're dealing with.
The stunning amount of interactions between addicts and doctors like Julia Peary of Yale New Haven Hospital speaks to the epidemic level of our opioid crisis today.
During my residency, there were a lot of people coming in asking for opiate pain medications for pain, and when it wasn't given, there's this sense of, well, other people are giving it to me, why aren't you giving it to me? For me personally, I would probably say that would amount to maybe 30 people a month that I'm interacting with who have some sort of opiate dependence of some kind.
We have seen the explosion of the opioid epidemic on the front lines with our patient population and watched it grow, and unfortunately, it has escalated to the point where I think everyone now regards it as an epidemic.
The reality is that many opioid and heroin abusers get their start in drug use through what many parents have been raised to believe is a relatively benign vice.
Far too many of us as adults, again, are worried about, well, I smoked a little weed, it's not the worst thing. Weed's good for you. Weed's great. It's natural. When I grew up, I can't tell you how many times I heard the gateway drug term, right, about weed. It's terrible, it's a gateway drug. I never really understood the magnitude of what they were saying, because for me, knowing what I know now, every person that I've spoken to, with the exception of one, in 34 years, every person who's addicted to heroin will tell me that they started out by smoking weed.
Here in Connecticut, we formed a statewide task force with the DEA and the police. In the last 9 months, we've investigated 80 overdose deaths and charged 44 dealers and suppliers. But the hard truth is we cannot arrest ourselves out of this problem. Addiction is a disease. We must strip away the stigma and the shame.
I started smoking marijuana about age 14. I had a lot of social difficulties growing up, and marijuana became one of the first substances I used.
So when I'm talking about teen drug use, I'm talking about 12 to 17-year-olds, so basically from 7th and 8th grade up through high school. So 2.3 million teens are currently using illicit drugs. That's a very large number. The most commonly abused continue to be marijuana, followed closely by pharmaceuticals. What we've learned is that approximately 2,200 kids try pharmaceuticals every day for the first time, use it non-medically, meaning they weren't prescribed it for a proper reason, or they were prescribed it and are now using it for an improper reason.
Towards the end of high school and the beginning of college is when I first started experimenting with opioids. For a while, I did think I had it under control. My grades were going great in school. I was working a part-time job, but slowly I realized that when I began using opioids that control just slipped out of my grasp.
Kids are getting their hands on OxyContin and they're not realizing how addictive they are. Once your money starts drying out and life starts getting tougher, you switch from using OxyContin or Percocet or Vicodin and you switch over to heroin.
It was an introduction by a former friend that made the jump to heroin.
But Wade Pettengill is one of the lucky ones. His arrest and subsequent cooperation with the U.S. Attorney's Office helped him and his family get their lives back on track.
I think truly probably Wade being arrested, as terrible as that was for me, at least I knew that he was put in a position where help would be there, and I think he was much more receptive to getting help at that point, so that was really a good thing. It's a very, very tough, it's an isolated spot for a parent, and it's a hopeless spot.
Those who have never had a loved one addicted to opiates think the warning signs of the problem are unmistakable. But one parent involved in law enforcement who wishes to remain anonymous says that is not the case.
I was a law enforcement officer for 28 years, and I had a lot of experience with drug interdiction. I was assigned to a drug task force for 9 years. He was fighting an addiction from heroin. He was on it for quite a bit of time before I or my wife recognized that there was a problem going on. I finally was able to find a syringe one day with the glassine bags in his car. And at that particular point, my wife and I, we confronted him, and he admitted that he had a very strong addiction. We told him that we would back him 110% to seek help, for him to fight this battle and try to get rid of it. After spending my whole career fighting against drug dealers and drug users, and ending up, trying to save my own son. It's very traumatic, and I don't wish that on anybody.
This is the number of prescriptions in millions in the United States for hydrocodone, so that's the medication in Vicodin, and oxycodone, which you can get as oxycodone or just Percocet. That's not even all of the opiates that we prescribe. But you can see in 1991, about 76 million prescriptions were given out. By 2013, that had tripled to 207 million. So doctors are handing this out, and we were told to do so because we wanted to treat pain. And again, I don't want to undersell the importance of that. I think pain control is important, but we need to make sure that we're actually treating the condition causing the pain, not just treating the pain. So this is what happened. And I should also point out that this is not how pain is being treated outside of the United States. The United States makes up basically 100% of the market for hydrocodone, and about 80% of the market for oxycodone. So we are the ones using this, the rest of the world is not.
Many young people today are being prescribed painkillers after surgeries, even dental procedures, that can lead to problems long after their pain has subsided.
Ryan was an active, outgoing young man, young boy. He had plenty of friends. He had sports activities in his interests. He played baseball. As he grew older, he also had surgeries to correct some birth defects, and he had an accident with his quad. So that was where the painkillers and the pain medicine came in. We never got a fine date when he actually started on the heroin, but he started using on a regular basis in his 20s.
Ryan Phillips died of a heroin overdose in 2015. Looking back, Bill Phillips has advice for parents who observe what may seem like unremarkable behavioral changes in their children.
I would say most of these signs are very subtle, but together they can point to a very serious problem. You might have a student that's slipping in their grades. Their social activities may have changed, their friends have changed, they're not engaging with the family as much, and they're going to start taking money if they see tools, jewelry, household items, something vanishing. At first it may seem like you're slipping your mind and say, well, I lost it. But together these signs all point to a serious problem.
In Connecticut, the driver that we are seeing is fentanyl, a synthetic opioid that is up to 50 times more powerful than heroin. The user often doesn't even know that they're using it because it's mixed in with the heroin. And the third thing that we're seeing is often these young people are also on a prescription benzo, Valium, Xanax, for depression or anxiety. And then you have a particularly lethal toxic combination, a new heroin user on particularly potent heroin and with a benzo in their system.
For those on the front lines of this crisis, stemming the tide of addiction can prove a daunting challenge.
There's a feeling of helplessness. You get people through an acute overdose and then you try and talk to them and then they leave the hospital, but there's a part of me every time that knows that person's probably going to use again.
So what can you do to help? So there are a number of things that you can do. First is be cautious. If a doctor offers you an opioid prescription for you, for a friend, for your child, think about it. Can you use an alternative before you go to that medication? If you do need it, use it sparingly. And when you're done with it, get rid of it. Because again and again we are seeing that these addictions are starting with a prescription that someone finds in a house. Finally, intervene. If you see someone that you think is slipping into addiction, stand up, speak up, intervene. Addiction is a disease. We must strip away the stigma and the shame.
That stigma that goes along with the opiate addiction, and these people don't want to share. And I say you are absolutely responsible for sharing that information. If people see that other people just like me are going through the exact same thing with their family, if more people saw that, more people might be willing to share and talk about it.
One of those people is Anne Marie Taylor, who has bravely refused to sit silently after the painful loss of her son, Michael.
In our town, Michael, because he was such an athlete, is very well known. Our family is very well known, and many people, if we went skiing, they were always friends with us. And so people are now afraid, because if it could happen to Michael, it can happen to anyone. It's a huge problem, and I am committed to working with a couple of universities that are looking at starting studies on genetic risk factors. Some of these kids that are exposed to opiates because of surgery, maybe we could not expose them to it, or maybe there's a test that could be done before they go into the hospital and get put on it.
I'm a parent. I can't imagine seeing my child in that much pain, and I understand the impetus of saying give them something for pain. I think the real issue is, do we need to jump to that medication first? You know, can we try other pain medications that aren't going to raise the addiction potential first?
An often overlooked problem with opioids is the long list of side effects they carry with them.
So there's a lot of long-term side effects that we worry about. It can actually affect, in men it can affect testosterone levels, and it can decrease their energy and make them a lot more fatigued. For women, it can affect their menstrual cycles and make it harder to become pregnant, which also can affect mood. So all of that can play a role.
We thank the brave parents who have so kindly shared their stories in this film. I want to thank you. Thank you for watching this video, and thank you for partnering with us in standing up to this opioid epidemic. I am confident that together we can and we will